This video is on the types of leukemia and lymphomas, explaining how they arise, why they have the symptoms they do, and how they're different from each other. All of the types of blood cancer fit into two categories, myeloid and lymphoid. All myeloid cells come from one type of stem cell, and all lymphoid cells come from another. Myeloid cells include red blood cells, platelets, and most white blood cells. Lymphoid cells include B cells, T cells, and natural killer cells. Most blood cancers specify somewhere in their name whether they come from myeloid or lymphoid cells. The names of some cancers mention a more specific cell type. For instance, erythroblastic leukemia originates from erythroblasts, which are immature red blood cells, and thus a type of myeloid cell. One counterintuitive name is multiple myeloma. It's actually not myeloid, it's lymphoid. More on that in another one of my videos. The distinction of myeloid versus lymphoid is important because these two types may respond differently to chemotherapies. Lymphoid versus myeloid cells also interact differently with other cell types, producing different complications. For instance, the cancerous cells of acute myeloid leukemia can trigger blood clotting, while those of acute lymphoid leukemia typically can't. To further divide the myeloid versus lymphoid categories, we can ask another question. Where in the body did the cancer cells originate from? Again, there are only two options, either the bone marrow or lymphatic tissue. Lymphatic tissues are part of the immune system and occur throughout the body, so cancers in lymphatic tissue can occur in almost any region of the body. Lymphatic tissue includes lymph nodes and is explained in another one of my videos. Cancers arising from the bone marrow are generally called leukemias, while cancers arising in lymphatic tissue are called lymphomas. However, myeloid cancers generally do not arise in lymphatic tissues. This means all cancers arising from lymphatic tissue, and thus all lymphomas, develop from lymphoid cells. In contrast, both myeloid and lymphoid cells are present in the bone marrow, so bone marrow cancers, including leukemias, can be either myeloid or lymphoid. Because leukemias develop inside of bones and from cells that don't stick together very well, leukemias don't produce a lump. In contrast, lymphomas arise in softer tissues and do form lumps. However, just cutting out the lump can't cure lymphoma. This is because the cells lymphoma develops from don't stick together that well. They move apart and start growing in other parts of the body before lymphoma can even be noticed. Lymphoma cells can even spread into the bone marrow, and in rare cases can arise in lymphatic tissue within the bone marrow. Almost always, though, lymphoma starts out as a lump somewhere outside of the bone marrow. Leukemias can also spread to lymphatic tissue, but because they are leukemias, they by definition start in the bone marrow. There are cases where by the time the disease is noticed, cancer cells are in both lymphatic tissue and the bone marrow, and we can't tell where they were first. In those cases, it's arbitrary whether they're called leukemia or lymphoma. Since lymphomas originate physically away from the area where blood cells are produced, the bone marrow, lymphomas tend to initially have only small effects on blood cell numbers. In contrast, leukemias can change blood cell numbers quite a lot. It's the altered blood cell numbers that produce many of the symptoms of leukemia that we'll talk about in just a minute. In contrast, lymphoma symptoms are more related to lymphoma cells using the body's energy, resulting in weight loss and weakness, and triggering immune response, resulting in fever and night sweats. There are two main types of lymphoma, Hodgkin and non-Hodgkin. Hodgkin lymphoma was originally noticed as something different because the cells look different. In a Hodgkin lymphoma mass, there are many different cell types, including distinctive-looking lymphoid cells called Reed-Sternberg cells. In non-Hodgkin lymphoma, cancerous masses are filled almost entirely with identical-looking cancerous lymphoid cells. Distinguishing Hodgkin and non-Hodgkin is important for choosing a treatment. Lymphomas can then be further classified by exactly where they arise and exactly what cell type is affected, usually B or T cells, but sometimes natural killer cells. Now let's come back to cancers arising in the bone marrow, which include leukemias. To distinguish between them, we need to ask another question. Are the cells maturing? Cell maturation is, in a way, like human maturation, growing up and becoming able to do a certain job. Leukemias in which the cancer cells can mature completely are called chronic, and those in which the cells can't are called acute. It is true that chronic leukemias tend to progress more slowly, but the terms acute and chronic actually refer to whether or not the cancer cells can mature. Normally, immature cells, which we call blasts, are blocked from leaving the bone marrow. However, so many immature cells are generated in acute leukemia that some do escape into the blood. These may be noticed on a blood test as a sign of acute leukemia. However, the majority of acute leukemia cancer cells remain trapped in the bone marrow. They take up so much space that the marrow doesn't have room to make the usual amounts of the normal blood cells. The number of normal blood cells drops, resulting in anemia, bruising, and bleeding, and sometimes infections. All of these are the initial symptoms of acute leukemia. Thus, it's the lower numbers of normal cells, and not the cancer cells themselves, that give the initial symptoms of acute leukemia. Now, in chronic leukemia, cancer cells are still produced in the bone marrow, but can mature and can easily enter the blood. The increased number of mature cells in the blood may be noticed on a blood test and is a sign of chronic leukemia. Note this is opposite of the low cell counts and immature cells in the blood for acute leukemia. Since cancer cells in chronic leukemia do leave the bone marrow, they take up less space in the marrow and interfere less with the marrow's production of normal cells. Symptoms are instead related to the use of lots of the body's energy and resources to make all the cancer cells. This leads to fatigue and weight loss. The spleen can also be affected. It may become enlarged as cancer cells accumulate there. An enlarged spleen can cause symptoms if it presses against other organs. We can go back to our summary table and add on this criteria about cell maturation. Overall, we've covered the three properties of leukemias and lymphomas: myeloid versus lymphoid, bone marrow versus lymphatic tissue, and can versus can't mature. For more information about multiple myeloma, myelodysplastic syndromes, and myeloproliferative disorders, see my other blood cancer clips.